We are going to see topic reproductive health. Within the framework of whose definition of health as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity, reproductive health addresses the reproductive processes, functions and system at all stages of life. Reproductive health therefore implies that people are able to have a responsible, satisfying, and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. Family planning, counseling, information, education, communication, and services, education and services for prenatal care, safe delivery and postnatal care, especially breastfeeding, infant and women's health care, prevention and appropriate treatment of infertility, abortion, sexually transmitted diseases, and reproductive tract infections. Information, education, and counseling as appropriate on human sexuality, reproductive health, and responsible parenthood. World population reached 1 billion just after 1800, but it took less 125 years to add the second billion in 1930. In 1960, the world passed the third billion. Within 40 years ahead, the population doubled to be 6 billion in 2000. In year 2010, the world population reached 7 billion. The majority of this expansion has taken place in developing countries. The encouraging news is that the rate of growth is declining since 1960. The rationale is to reduce unintended fertility because of its negative health and welfare consequences, and because it has been recognized as a human right. Over the last 50 years, the dissemination of modern ideas about small families was adapted. In part, due to lack of availability, accessibility, and effective contraceptive, the gap between observed and desired fertility is grew, leading to, in turn, to an increase to unintended fertility. According to WHO, in 2005, out of 211 million pregnancies, 87 million women became pregnant unintentionally. Improvements are needed in the quality of family planning services, especially in the areas of information exchange and methods choice to reduce fertility and unwanted pregnancy. Maternity care needs to be significantly expanded too, while preventive services, including education of both men and women in healthy and sexuality, family planning, and prevention of STIs, need to be increased. At societal level, programs need to be supported to improve the status of women through education, changes in laws and cultures. Strategies. A number of programs are launched under reproductive and child health care. Awareness programs are conducted for both male and female to lead healthy reproductive life. Awareness creating about fertility regulating method. Awareness creating about personal hygiene. Preventing and protecting against sexually transmitted diseases. Population explosion and birth control. The increase in size and growth of human population is called population explosion. The reason for high population explosion are decline in death rate, longer lifespan, decline in maternal mortality rate, decline in infant mortality rate, some religious belief against birth control, lack of reproductive health knowledge. Birth control. Family welfare and family planning programs comes forward to avoid uncontrolled human population explosion. The contraception is the main aim of the birth control. Prevention of conception or fertilization of ovum during sexual intercourse is called contraception. The different types of contraception are natural method, barrier method, intrauterine device, oral contraception, injection and implantation, surgical method. The first is natural method. It works on the principle of avoiding chances of ovum and sperms meeting. Periodic abstinence is a method in which couple avoid or abstain coitus from day 10 to 17 of menstrual cycle when ovulation could be expected. Withdrawal or coitus interruption. In this method, male partner withdraws his penis from the vagina just before ejaculation to avoid insemination. Thank you.